Hello again, this is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology. Welcome you back as I highlight an important paper from the May 2024 edition of the Journal of Rheumatology. Today I have the pleasure of speaking with Drs. Jennifer Rogers and Amanda Eudy, who are two of the authors of the featured article titled Patients and Physician Perspectives, a Systemic Lupus Erythematosus Flare, a Qualitative Study. I want to thank you both for taking the time to speak to me and our listeners on behalf of all the authors of your paper and allowing us to discuss the findings of your paper. So with no further ado, we'll start. So what was the hypothesis of the study?
Yeah, thank you. So it's been well described in the literature that there's a discordance between patient and physician assessment of disease activity. And in our lupus clinic at Duke, we collect a lot of patient-reported outcome measures as part of our research and our clinical care. And we observe that lupus patients may often indicate that they're having a flare, including really moderate to severe self-reported flares, but that doesn't correlate with the physician assessment of a disease activity or labs. And so that made us hypothesize and wonder, should we explore this more, and can we really kind of measure and assess the difference in what patients are describing as flare and what physicians, including rheumatologists, are describing as flare?
Want to add anything?
No, Jen covered it nicely.
You're talking about that I find that it's the most discordant of all the diseases. What we as physicians look at disease activity and how patients feel. But that's why I really like your paper. Yeah. So outline the exact aims of the study.
Sure. Yeah, so our objective in this study was to explore how patients with lupus and how rheumatologists define and view lupus flares. So for patients, what signs and symptoms do they experience when they have a lupus flare? And then for rheumatologists, what are they considering to determine if a patient is having a flare? And then seeing if they are describing similar or different experiences.
And just moving along, can outline the methodology used and how did you study the patient?
Sure. Yeah, so for our patient interviews, we enrolled patients from the Duke Lupus Registry, and we use purposeful sampling. So that means that we selected patients based on a number of different factors. So their age, their race, ethnicity, gender, history of lupus nephritis, and then recent disease activity and symptoms. And we did this so that we'd have a study population that really reflected the experiences of a wide range of people with lupus. So I interviewed our patient participants, primarily over the phone. And during each interview, I asked them to describe what a lupus flare means to them, how long flares typically last for them, what triggers, if any, they have noticed that sort of make them have a flare, and then how they manage their lupus flares.
You want to add anything, Jennifer? No, you're good. Okay. So and how were the rheumatologists interviewed, and how did you decide on which ones to ask?
Sure. So for our rheumatologist interviews, we selected rheumatologists in the US and Canada who are either members of the American College of Rheumatology or who participated in the 2019 International Congress of Lupus, the meeting that was held in San Francisco. And so again, for this, we use purposeful sampling. So we wanted to, again, make sure we had a wide range of experiences represented in our interviews. So we reached out to private practice and academic medicine rheumatologists. We made sure that we had a mix of providers based on age, race, gender, years of clinical practice. All of them cared for patients with lupus, and about half of them really had a clinical focus on lupus. So they have a lot of experience treating and managing lupus patients, just to make sure we got that perspective. So the providers were interviewed over Zoom, and for these interviews, we used some collaborators in a qualitative research group at Duke who were outside of our lupus clinic team. And so during interviews, they were asked to describe what a lupus flare means to them, and then what approaches they use to manage these symptoms that patients really report for their flares, so chronic pain, fatigue, and brain fog. And then for both sets of interviews, for patients and providers, we then use applied thematic analysis to explore the patient and physician description of flares and to identify our key themes.
Yeah, and I would just add to that, we felt it was really important to have that mix of both private practice rheumatologists and, academic rheumatologists. And we included several lupus specialists, who have done a lot of lupus research and are aware of, take care of these issues. So we felt we had a really broad range of people that could speak about this.
So, and did you find big differences between the groups of rheumatologists or not really? I know I didn't prepare you for this, so sorry.
No, I feel like I don't think there were differences in the academic versus the private practice providers. No.
Yeah.
Okay, good. So now the money. So can you compare and contrast the definitions?
Yeah, so lupus patients really kind of defined and talked about their flares more in symptoms. They kind of described the symptoms, and so, but particularly they listed pain, muscle pain, joint pain, fatigue, but they also talked about brain fog, kind of a prodrome, achy flu-like symptom. So they described it in terms like that. Most patients really did not consider or describe like an objective measurement or a lab, even though many patients had nephritis and definitely had, a history of internal organ manifestations. Only one patient actually included nephritis as a sign of flare or noticed that flare. And no one really specifically talked about having to have a requirement for medications or thinking of it that way. They sort of think of it holistically in the symptoms that they're feeling. And this was definitely in contrast to rheumatologists, right? We had a much more formal definition, and everyone included some, increase in disease activity in organs. And more than half of rheumatologists really required that objective finding that, and again, that you had to necessitate either giving escalation of therapy or definitely thinking about escalation of therapy. And that fits with, I think, some of the published definitions of flare. But, less than half of people included any of these symptoms of fatigue, brain fog, pain, flu-like symptoms. And importantly, 2 people excluded them. They thought if those were included, that is not part of the flare. And so some people actually felt strongly about that. So there's definitely—
Are these physicians or patients? We describe it.
Oh, those were physicians. The physicians definitely felt strongly that, too, that should not be included. Yeah, the patients included all of those symptoms in their definition of flare.
Yeah, I think that's what you hear at all the meetings. This is why do we ask those questions from a minority? And it was a minority of physicians in your study.
Yeah, a minority felt very strongly about it, that they should be excluded, right? But then, only half of the physicians felt that was a feature of it, which I think is important too, and kind of draws, we should be including those symptoms because patients have them, right, and experience them.
So leads into the next question. So as a result, do you think we should change our definition of flare or consider changing it? And if so, how?
Yes, and I think perhaps being more specific when we're, definitely with patients, but also I think perhaps in our literature and we talk about flare amongst ourselves. But how I have used this study and view it as kind of talking specifically about a measurable increase in disease activity, right? Because when you think about flare, is it a relapse of prior symptom? Is it a new onset of symptom? Is it just continuing persistent activity? All of those are important and should be addressed, and, cutting, within flare, there's a time period component, but if someone has continued activity or a slight increase in smoldering lupus, that still needs to be addressed and is measurable. So I think about using, activity. I also, we use the type 1, type 2 model, and I think about flare in both, right? So you could be having a flare, or what I say is a measurable increase in disease activity of type 1, and we will address that with immunosuppression, for example, and or at the same time, they're having a measurable increase in type 2 disease activity, and we're going to address that. And so kind of focusing on both of those has been our approach to thinking about flares, so type 1 flare or type 2 flare, but really using disease activity.
As I'm sure some of the listeners aren't as familiar as others with type 1 and type 2 flares, can you just briefly outline the differences as you see them? Oh, yeah. Because you guys defined them. So perfect people to ask the question to.
Yeah, so we think about the type 1, type 2 lupus model of symptoms or manifestations, right, or activity, I would say. Type 1 activity is the traditional lupus symptoms that we all think about, right? Arthritis, nephritis, things that are measured on the SLEDAI and the BILAG and are immune-driven. Type 2 activity or symptoms include those that fatigue, brain fog can often go hand in hand, although not always, right, with mood disorders, kind of diffuse pain, symptoms of lupus that are very common and cause a lot of distress and debility for our patients, but aren't necessarily measured on traditional measures of lupus activity, and may or may not be driven by lupus inflammation, right? The cause of those symptoms is very complex. And, most of those symptoms do happen with type 1 flares and kind of may begin when someone has lupus, but oftentimes they can persist during times of remission. And I think there's multiple factors, as we all know, that can drive fatigue and pain and sorting that out. And so our approach is to talk about all of them because patients really care about those type 2 symptoms, and sometimes patients can't separate them either. And so talking about all of them, incorporating that, it's not a job, I think, as a rheumatologist to manage all of those features. We can't, right? You have to have an entire team, but I do think it's important to address them and listen to our patients and validate those symptoms and, encourage them. Yes, we should be seeing physical therapy or working with your psychologist or whatever it may be. I think that comes a long way, hearing it from the rheumatologist, and then, embracing a kind of larger team.
I think that's one of the issues that some physicians have a tough time getting their head around, sort of symptoms in a lupus patient and lupus symptoms. Not saying they're not both important, and that's the point I think you're trying to make. They're both very important for quality of life, and they have to be treated, may have to be treated differently. And then as you address, there's this overlap in some people where the type 2 symptoms only occur when there's an objective as a physician sees it. And that's our dilemma.
Yeah, and it's very hard to tease out, but right. So sometimes those type 2 symptoms are driven by inflammation. And then you have someone in remission with their nephritis, and actually their fatigue and their pain, may be much better, but not always. So, we do need better tests and biomarkers and to understand these symptoms further. But, step one, I think, is just talking about them, addressing them in that way and explaining it to patients. And it goes a long way for care.
Yeah, and patients really consider them all to be a part of their lupus too. So that's also kind of why we've embraced this model, because it gives us a way to talk about it, sort of using similar words that patients use, but still making sort of a distinction between type 1 versus type 2 symptoms.
And I think it, in many ways, it is a good way to think about it and educate your patients. I guess we should educate our parents. That's a separate issue. Well, I'm a pediatrician, so we have to educate parents too. So I guess that's where my brain comes from. But anyway, after that faux pas, coming back, I think it's very important that we have to educate them that we will treat those symptoms. We might treat those symptoms differently.
Yeah.
Right. I mean, that's what you're getting at.
Exactly. And it's important to set expectations, right? So we're going to give someone methotrexate or belimumab or you name it. It may not make those symptoms better. That doesn't mean we need to give more or different or more steroids for sure, right? That means that perhaps we need to find another approach to treating those complex symptoms.
Okay. So is there anything you think we missed that you'd like to add?
Yeah, I just had one final point. So Jen's talked about the clinical implications of our study, but I just wanted to sort of talk about what it means for research. So when we're collecting data on patient-reported flares, just remembering that these flares don't always translate to physician-reported measures of flares or lupus activity. So when we're using data sources that only have patient-reported measures, it's just important to consider how to interpret these measures. We love patient-reported measures. We include them in our clinical care. We include them in our research because it's just really important to understand the patient experiences and what they're feeling. But as we've seen in this study, these patient-reported measures cannot always be interpreted the same way as like physician-reported flare. So both are important in clinical research to get a full view of the patient's experiences with lupus, but they're different outcomes that are measuring different aspects of lupus.
Absolutely. So in that case, I want to thank you both, Dr. Rogers and Eudy, for taking the time to go over the findings of your paper and importantly, what it means to patients. I think that's the crux of what we're discussing. And I invite our viewers and listeners to read the complete paper, which is entitled Patient and Physician Perspectives. I guess that's what we're talking about, systemic lupus erythematosus, FLAIR, a qualitative study. And I think maybe you should have changed, after the fact, change it to activity. I like that idea that you were getting. I didn't make it up. You guys made it up. So. And there is an accompanying editorial, which you should also read, called Flare in Systemic Lupus Erythematosus, Lost in Translation, by Drs. Eric Moran and Sarah Jones from Monash University, Melbourne, Australia, both of which are available at our website at jroom.org and will appear in the May print edition of the journal. And I want to thank you all for joining us and hope you'll come back next week when I'll speak to the author or authors of an article of particular interest from the June 2024 edition of the Journal of Rheumatology. And if there are any comments or questions, please send them to us on X at jroom or by email at manuscripts@jroom.com. Thank you.